With us now is Dr. K, Dr. Kevin Kavanagh, founder of a national organization called Health Watch USA, and also a retired physician himself. And good morning to you, Dr. K.
Good morning, Jack.
Let me share this information, and then I want to get your reaction to it first thing. Yesterday, Governor Andy Beshear, as you know, announced that on May 28th, all events and businesses with 1,000 or fewer people present can increase to 75% capacity. In addition, May the 28th, indoor and outdoor events with more than 1,000 people can be held at 60% capacity. Governor also clarified that small groups of individuals are no longer mandated to wear facial coverings indoors in private businesses or homes if all the individuals present have received the final dose of the COVID-19 vaccine at least 14 days prior. So how do you feel about these little bit loosened up regulations?
Well, at this point, I think I'd be a little bit more cautious. The CDC, because of the UK variant, is projecting a spike in May, and then hopefully it will subside. And of course, you have other variants which are even more of concern, such as the Brazilian variant and the South African variant, which we need to worry about. One of the things that I really would like to advocate for, and that's better indoor air quality. You know, we've been talking about this since last August. I think this is of utmost importance because we now know this virus can spread with aerosolization. And with aerosolization, according to a recent MIT study, which was published in the Proceedings of the National Academy of Sciences, that aerosolized virus can spread throughout a facility. So when you're indoors with poor ventilation, really nowhere is safe. And outdoors is safer because the aerosolized component of the spread tends to rapidly dissipate. But droplet spread is still there, so if you get up close between 1 to 2 feet away from someone, that can still be a problem of acquiring the virus through droplet spread. The vaccines are absolutely wonderful, and we would have been out of this completely with the exception of the variants, and they're kind of the unknown question mark. Luckily, we do not have a lot of the variants in Kentucky at this time, but I think it's safe to say that at least with the Brazilian variant, you may get infected, if not asymptomatically. Chances of that are not as great as if you don't have the vaccine, but there's still concern that you could spread, the virus could mutate, and sometimes even those vaccinated could become sick. And one of the things you need to realize, Jack, is that there's two factors that I believe are present. One is if you're old and you're frail, I fall into that category, you're more likely to become sick, but the other is viral dose load. And that's why wearing a mask is important. So I guess what I would have done is said that these are guidelines, that if everything continues to go well, this is what's going to happen. But we also need to make sure that indoor facilities upgrade their ventilation because this virus is here to stay and we need to make things as safe as possible as we can for both our children and for patrons.
What do you mean this virus is here to stay?
Well, I believe, along with many scientists, that you've got the virus throughout the world. It is mutating, it is in animals, and it has become endemic. And so it's going to be very hard to completely get rid of it. You can't get rid of the flu, and that is a much less infectious virus. And so I think we're always going to have to learn how to live with this. We'll have outcroppings of outbreaks here and there, which can be snuffed out with good contact tracing. But as far as ever getting to a point where we don't need to have a booster or we're not monitoring for outbreaks, that probably won't happen. I mean, just this week, Moderna announced that they are coming out with a voluntary booster, 2 additional shots, hopefully later on this year. One is a lower strength shot for the previous or original virus, and the other is a new shot which is directed against the South African variant. And so We're seeing now 4 shots that I might have to take. And of course, I'm very shot adverse, as we've talked to before. And this goes along with that this virus keeps mutating, and it's of utmost importance that we stop its spread, because this is the best way to stop its mutations. And that not only means in the United States, but also worldwide. We can't take an isolationist type of a strategy. We have to stop this virus's spread worldwide, much like terrorism. It's much better to fight the fight in another country where it's originating than wait till it spreads to our shores. And so we really do need to get to that point and to gear up the CDC's foreign activities as far as surveillance, case tracking, and also containment of these contagions in foreign countries.
Here's someone that says, I'm a loyal listener, but I can't listen to this guy anymore. Mask, goggles, update your ventilation, ugh. We get that. We get a lot of that because people don't want to hear bad news. And is it people don't want to hear it, or people don't want to believe it, or they don't believe it, or is it just a combination of things?
Well, I think it may be a combination of things. But to be honest with you, Jack, the ventilation should be done regardless of the coronavirus pandemic. I mean, it's been well known in the community that during the flu season, the schools are kind of magnets for the virus and the kids tend to spread it home. Again, ventilation, aerosolization is key in preventing spread. This is just good public health advice. It's just like the questions that say, well, do I have to wash my vegetables after I buy them when the coronavirus goes away? Well, of course you do. You have to do that anyways. So some of this is how our society has to change and should be changing in order to live safely. So yes, ventilation is important. Whether or not you wear a mask with these variants, that's going to depend upon the risk that you are willing to take, but also it's going to depend upon what your status is and your biological risk is, whether or not you're old, if you have a health problem, etc. Let's not forget that you've had people that were treated with chemotherapy or transplant patients that would wear masks on planes before the coronavirus because, again, they were protecting themselves against pathogens. So it's just not how much risk you want to take. It's also a risk versus benefit ratio, but we need to put both of those things together. So just because someone is wearing a mask doesn't mean he's crazy. Maybe he's on chemotherapy. Maybe he has a cancer.
Right.
Maybe he's very high risk. You need to respect that person, and please try not to get him infected because that could cost him his life.
Tell us some good news about both Pfizer and Moderna.
Well, there's a lot of good news. One is that Moderna, as I said, is coming out with boosters to try to increase our layers of armor against both the variants and to reinforce immunity to the wild type of a virus. And Pfizer is asking now for formal FDA approval of their vaccine. They have enough data. As you know, currently it is just authorized. And I think that should be a big topic for the show, because with formal approval, that I believe would open up vaccinations and mandates. And that's something, as you know, is very controversial. However, for one, I believe that healthcare workers, especially in a nursing home setting with old, frail individuals, should be mandated to have a vaccine. So it would be interesting to hear other viewers chime in on this.
Lane, you had a question for the doctor?
I sure did. COVID is getting a lot of attention, as it should. But I'm kind of curious, what other health issues are out there that should be on our radar that aren't?
Well, one is resistant bacteria. That is another problem as we've gone more to telemedicine, pretty much a type of examination where you're not doing a physical exam, just a history. Antibiotic usage has tended to rise. And so that is one of the problems. And of course, you also have difficulties with diagnosing, such as cancer and such as other major illnesses. And I can tell you that's something I've wrestled with. And I've had to go to the doctors repeatedly and have repeated surgeries last year with these health issues. If you don't do that, risk versus benefits, you're going to be at a disadvantage. So you have to take care of your other health issues, and that's of primary importance. And I can tell you, if I come down with COVID, please continue to get vaccinated, but it will be because I have to go to high-risk settings to get treatment. And get treatment. Do that. You're much better off. Additionally, psychological problems are abound. I mean, just the isolation is a problem. Decreased physical contact is a problem. And plus, the virus has a direct effect on the brain and CNS. And that's one of the reasons why you're hearing all of these patients with long COVID having problems with memory, problems with concentration. So it's kind of a double whammy. The environmental conditions are primed for psychological problems, and so's the virus to augment that with its infection. And so all of that combined are things that we need to look out for. This is one of the reasons why we want to get vaccinated so we can get out of this pandemic as fast as we can. And I should add that the vaccines, although they may not be fully protective against the variants, even the high-level variants, they do afford you some protection, and they will likely keep you from getting severely sick or dying. In addition, they should give enough protection to decrease spread enough that you will see rates fall in the community. In other words, it gives a community protection where the pandemic, along with other social and epidemiological measures, could burn out the pandemic. So there's two goals. One is a community health where the viral rates go down. The other is individual health where you have enough protection where you feel safe doing some activities which actually may be high risk. Those are two things that we need to discuss about in the future. But right now, we still need to get our health issues treated. That's of utmost importance.
Did you get to mention the Moderna 96% effectiveness with teens?
No, I didn't, and that is very good. That is a huge plus with the Moderna vaccine, and it will be soon getting a EUA, I believe it's next week, with the FDA for vaccination of 12 to 17-year-olds. And of course, that is going to be one of the keys to not only getting in-person school going, but to opening up our economy. So if you combine good ventilation in schools, public health, case tracking, and contact tracing, this, I think, will be key to getting us back to normal and also opening the economy. It's hard to open up the economy when parents are still home because their kids are in a blend program or still doing teleschooling. So let's go on ahead and get our children vaccinated. It's highly effective. And even though children may not die as often, and they don't die as often from this disease, they're still susceptible to chronic illness and long COVID. So it can still cause significant problems, and we need to go on ahead and get our kids vaccinated.
And what was that condition that we heard a lot about that was prevalent only in kids, but I haven't heard anything about it for a while?
Yeah, that's a multisystem inflammatory disorder that is still around. Yeah. And that condition is a very severe effect from COVID-19, but it's also quite rare. And I think that as the children have been protected, as the schools have gone more to distant learning, you've seen that condition kind of abate or go away. But it's still out there. And as we get back to school, you still need to be vigilant with the health of your children.
Dr. David Kavanagh, have a great weekend. Thank you.
All right. Thank you, Jack.